Welcome to the Imaging Techniques demo for the Daytona device. This video provides an introductory overview on the proper operation and imaging techniques for Daytona. Let's review the different parts of the Daytona. This is the device, which sits on a height-adjustable table along with the touchscreen tablet. These are the face pad, dust plug, and the table height adjustment buttons. The server, which stores images, should be turned on before starting up the Daytona. At the beginning of each day, remove the dust cover and the dust plug. To turn on the device, locate the on-off rocker switch on the back of the device and switch to the on position. The device will perform various self-tests before it is ready, which takes approximately 4 minutes. When finished, the login screen will appear. The status indicator light at the bottom of the device will turn green. To log in, choose from the cards at the top of the screen, then enter the password and tap Login. To create users to operate the device, you will need to enter them in Optos directory. Please see the separate training video on using Optos directory. The following procedures should be carried out before each session. Thoroughly wipe down areas that the patient will come into direct contact with. Clean the face pad with an individually sealed 70% isopropyl alcohol wipe. The eyepiece and the dust cap can be removed for cleaning on both sides. Do not let the alcohol wipe come in contact with the inside of the device. Do not use tissues to dry the area that has been cleaned. This could cause dust to collect on the mirror, which could compromise image quality. Allow sufficient time to dry before imaging the patient. To search for an existing patient, you may enter any combination of the patient's last name, ID, and add the date of birth to filter patients further. Select the correct patient card and tap to capture to begin imaging. If the patient is not found, you can add a new patient by selecting New Patient. Fill in the required fields indicated by an asterisk, including first name, last name, date of birth, which is in the day, month, year format, and patient ID. Select the appropriate gender, if desired, and the practitioner's name. When the information is complete, click the To Capture button in the upper right-hand corner, which will initiate system capture. This takes approximately 15 seconds. This is the main capture screen. On the left-hand side of the screen is the patient alignment view, followed by the automatic manual capture toggle, red, green, and AF option, on access and eye steering, stereo capture toggle, and Optomap Plus toggle. Operation of the device can be done manually or on automatic capture. It is recommended to attempt manual capture first. Select the appropriate image type before beginning. This is the patient alignment guide, which explains what color the target will be when the patient is in the correct position. This can be found in the marketing kit you received with your device. A blue light indicates that the patient is too far out. A green light indicates the patient is in the correct position. And a red light indicates that the patient is too close. Dim the lighting in the room to achieve maximum natural dilation of the pupils before attempting to capture an image. Have the patient sit up straight, moving the chair forward so that they are directly in front of the device, looking straight ahead. Adjust the table so that the tip of the patient's nose aligns with the top of the eye aperture. Have the patient turn their head slightly to the side, with their nose on the outside of the aperture as they slowly follow the blue light in until their forehead is touching the face pad. Guide your patient into position with verbal instructions. If the patient sees a blue light, they are too far out and should press in slightly until the light turns green, indicating the patient is properly aligned and ready to be imaged. If the light turns red, the patient pressed in too close and should move back slightly until the light turns green again. Verbally guide the patient into correct position until the light is green and the pupil is centered on the crosshairs. Instruct the patient to blink once and open both eyes as wide as they can, raising their eyebrows if needed, and tap anywhere in the patient alignment view window at top left to capture the red-green image. The image will appear for your review. Check the image quality and laterality. At the bottom of the screen, you can delete the image or swap the image laterality to change the right eye to left eye, or left eye to right, or accept. If you tap the screen once, you can remove all the titles on the screen. Tap again to add back the titles. Since the patient blinked in this image, laterality could not be assigned automatically, and appropriate laterality can be manually selected. With the patient in position, select AF. Verbally guide the patient into correct position until the light is green and the pupil is centered on the crosshairs. Instruct the patient to blink once and open both eyes as wide as they can, raising their eyebrows if needed, and tap anywhere in the patient alignment view window to capture the autofluorescent image. The Daytona system allows you to capture a screening Optomap or an Optomap Plus, a higher resolution image for a medically necessary procedure, in countries where appropriate. The menu button on the bottom left may have these two choices of image types if both are activated. Let's demonstrate eye-steered images. This will capture images further out in the periphery. Always capture a central on-axis image first before capturing an eye-steered image. Eye steering can be done for both red, green, and AF images. Move the fixation target by sliding the eye steering toggle to the appropriate direction: superior, inferior, nasal, or temporal. This will require the patient to change their gaze, but keep their head still in the standard alignment. Once the desired area is selected, verbally instruct the patient into correct position until the light is green and the pupil is centered on the crosshairs. Instruct the patient to blink once and open both eyes as wide as they can, raising their eyebrows if needed, and tap anywhere in the patient alignment view window at top left to capture the eye-steered image. To return the fixation target to the central gaze, tap the middle of the eye steering toggle. Let's demonstrate stereo imaging. On the tablet, tap in the box that says Stereo Pair. Move the control to Stereo 1. The crosshair will move slightly to the left. Align the patient to the proper position and capture Stereo 1. Move the control to the right for Stereo 2. The crosshair will move slightly to the right. Align the patient to the proper position and capture Stereo 2. These images can be viewed in Optos Advance with a pair of stereo viewers. Your device is equipped with an automatic capture feature. Tap in the box that says Manual to change to automatic capture. When auto capture is turned on, the device will automatically capture an image once the target turns green. Auto capture is very quick and can sometimes produce an image that is not properly aligned. If this happens, turn off automatic capture and use manual capture. Let's troubleshoot image quality issues. This is what an image will look like if the patient is too close. This is what an image will look like if the patient is too far. This is what an image will look like if the patient blinks. This is what an image looks like if there is patient movement or if the pupil is not centered. This is what an image looks like if the patient does not open both eyes wide. Thumbnails of the images captured will appear on the right-hand side of the tablet, sorted into OD and OS columns. Tapping one of the images will enlarge that specific image on the screen. You can then swap laterality or delete the image if needed by tapping the buttons at the bottom of the screen. Tap on the patient name at the top of the screen to finish the session. This will bring up a summary of all the types of images captured for each eye. Assure the summary is correct and click Exit Capture to end the session or Cancel to return to the image capture screen. Welcome to the Optos Daytona mirror cleaning demonstration. This video is intended to be an overview of the mirror cleaning process. Here are supplies that you should have on hand: Kimtech wipes, powder-free gloves, and pre-moistened wipes. The Daytona device has been used for demonstration purposes. This main mirror cleaning procedure is applicable across all Optos devices. Depending on the operating environment, dust may accumulate on the device and may affect image quality. If you think dust may be accumulating on the main mirror, you should follow the procedure in this demo. It is not recommended to routinely clean the main mirror. Only clean the mirror if dust particles, smudges, or spots have accumulated on its surface. Before we learn how to safely clean the mirror in your device, let's review some important items. The mirror can be damaged during cleaning. Preventing contamination reduces the risk of damaging the mirror. When cleaning the mirror, do not rub the spots too hard, as this may cause damage. Do not touch the edges of the main mirror, as they may be sharp. Only clean visible areas of the main mirror. Do not put your hand or any cleaning material into parts of the device you cannot see. Do not polish the mirror. Do not use lint cloths, tissues, or other materials that may create dust on or near the device. Improper cleaning methods or use of inappropriate cleaning and disinfecting agents can result in damaged equipment, poor imaging performance, and an increased risk of electric shock. Wear powder-free gloves at all times when cleaning the device. If gloves become contaminated in any way, they must be replaced immediately. Do not wear jewelry, for example, rings, watches, or bracelets, while cleaning the mirror surface, as this may cause damage to the mirror. Dispose of the dirty cloth after each use to avoid transferring the dust back onto the mirror. Switch on the device and allow to warm up and capture a reference eye image. Put on powder-free gloves. You can access the main mirror by removing the face pad, by gently pulling from the hard plastic part of the face pad. Do not pull on the soft rubber of the eye aperture. Inspect the surface for visible dust. Take note of any smudges or spots. The mirror must be viewed unaided and under ambient light conditions. Remove a single cleaning cloth from the packaging and fold it twice so that there are a number of layers. To prevent contamination, take care not to touch the surface of the cloth that will be used to clean the mirror. Starting at the top left side of the mirror, gently wipe the surface with downward strokes until completed. Discard the cloth if there is visible contamination. Check the mirror again for any remaining dust, smudges, or spots. If the main mirror still shows smudges or spots, use the Optos-approved pre-moistened wipes to clean the area. Fold in half twice as before. Gently wipe individual smudges or spots. Only wipe these areas and not the rest of the mirror. Use a Kimtech wipe to dry the area. Inspect the mirror surface and confirm all smudges or spots have been removed. Refit the face pad. Take another image and compare it to the original reference eye image to determine if the image quality has been sufficiently improved. Kimtech wipes and pre-moistened wipes are available from Optos and can be ordered by visiting our website at www.optos.com. Please notify Optos customer support if you have any questions or concerns about the cleaning procedure, or if you are not satisfied with the cleaning results. When you are finished for the day, tap the power button at the top left of the tablet and then tap Shut Down. Wait for the indicator light to turn yellow and then locate the on-off rocker switch on the back of the device and switch to the off position. Cover the scan head at the end of the day. You should log off the server at night. It is not necessary to shut it down. Here is some guidance for use on patients with epilepsy. The device uses flashes of laser light. Some patients with epilepsy may be sensitive to flashes of light. Caution should be exercised for patients who have a history of reaction to camera flashes or strobe lighting. This concludes the demonstration video. If you have additional questions, visit our website at www.optos.com.